Vancouver's downtown east side is known to be Canada's poorest postal code. Due to this area's high demand for social services, there is a large volume of welfare-based organizations.
Through a series of interviews conducted with the administrators of some of these organizations, we were able to identify a common set of issues faced by both private and publicly funded welfare organizations. These issues stem from an overarching problem of allocative inefficiency.
The sources of allocative inefficiency can be divided into three main areas. Multiple organizations are working to provide similar services. The overlap of service spreads an already small pool of funding thin and reduces the quality of services provided as resources are limited.
With the bulk of social services being located in the downtown east side, surrounding communities find their social services lacking. This leads struggling individuals to relocate to the downtown east side and causes further strain on the system. Furthermore, the high concentration of people struggling with drug addictions and mental illness can cause a negative feedback loop, as exposure to an unhealthy set of circumstances often leads to relapse. One interviewee also brought up the issue of low-income housing in the region. Currently, welfare checks provide a maximum of $375 a month, while the majority of housing outside the downtown east side costs upward of $450. As a result, people attempting to transition from living on the streets to becoming self-sufficient find themselves with no other option but to remain in this impoverished area.
Third, there is no standard set of measurements to assess the cost of individual welfare needs. Due to multiple systems of assessment and discrepancies of information, organizations lack the ability to properly allocate funding and determine where services are most needed.
Number one, a centralized umbrella organization would facilitate interaction between different organizations in the downtown east side, allowing a greater level of cooperation and diminishing the need for duplicate services. We identified the need for improved communication as a cost not currently accounted for by the private or public sector. Because communication would exist between a broad network of individuals and organizations, we believe it would be most effective to use a centralized, government-based approach. We are advocating for the government to create a new department of welfare-based communication to establish greater links between the bureaucracy and on-the-ground projects, as well as connecting the already compartmentalized sectors of health, housing, and welfare services.
The implementation of a system capable of assigning a dollar value to individual cases would help to create a standard set of information throughout the downtown east side. The data would also be made available on municipal and provincial levels, minimizing the lag between present need and government-funded projects. This model would be loosely based upon the current system of providing insurance quotas. However, it would quantify the social costs of illness, drug addiction, and housing needs, allowing for more efficient allocation of social services and government funding.
The poverty cycle in the downtown east side has seen minimal improvements over the past few decades. While we do not advocate an entirely socialized welfare system, the area currently lacks a centralized set of institutions to relay and process information. The creation of such institutions would be conducive to improving the conditions and effectiveness of service in the downtown east side.